we're incredibly concerned by the huge surge in the Omicron variant. Over the last 24 hours, we've had the largest number of new cases since this pandemic began, more than 26,000. Hospital admissions are going up, but also staff absences are going up by a massive level. So I've taken the decision, in consultation with our partners, to declare a major incident today. This is a statement of how serious things are, but also it means that rather than different public authorities working separately, we'll be working together through both the London Resilience Forum, but also through the Strategic Coordination Group. It's really important Londoners understand how serious things are. The best thing Londoners can do is to get both vaccines and the booster. They provide extra layers of protection. The really bad news is those in hospital, the vast majority are unvaccinated. That's why it's so important to get both the vaccines and the booster jab. Londoners will notice over the course of the next few days even more places across the city offering the vaccines and the booster. Behind the scenes, what they won't see is the coordination that's now going to have to take place a number of times during the course of a day between the NHS, the ambulance service, the fire service, the police service, City Hall, our councils. What we can't afford to see is even more of our crucial key workers going off sick because they have this virus. That's why it's so important to help us help you by getting the jabs that you need, the vaccines and the booster.
Mayor of London, Sadiq Khan there. Well, Caroline Russell is a Green councillor and is chair of the London Assembly's Health Committee, and she joins me now. Caroline, thanks for being with us. Now, can you just tell us, first of all, so of course this major incident that's been declared, Sadiq Khan did the same back in January. Can you just explain to us what it entails?
I think, first of all, it's a signal of how very serious the situation is that London is facing. We're seeing very high case rates. We have the borough, Lambeth is the borough with the highest case rates in the whole country. And it's a signal that we really need all our emergency services, our hospitals, our boroughs to work together to help get us through what is going to clearly be a tricky and difficult few weeks.
Well, just so people know, because of course it can sound potentially quite alarming to hear a major incident has been declared. So in real terms, in a practical sense, what will people notice? What differences will they see?
Well, we will see many more places coming open for people to get their vaccine. There's lots of people in London haven't yet come forward for their first vaccine. Some are still due their second, and many people are still due to get their booster. So the biggest message for all Londoners, so that we can all play our part in helping to reduce the number of people who get seriously unwell and need hospital help, is to all of us play our part and come forward for our vaccines. But the Assembly Health Committee, we've looked at the impact of coronavirus throughout the pandemic, and we have seen very high rates of infection, hospitalisation, and sadly also deaths. And what it seems right now is that we are seeing rising rates of sickness amongst our emergency services. So the fire brigade are not able to help the ambulance service with drivers because so many of the fire brigade workers are off sick with coronavirus. The ambulance service is seeing high levels of sickness as well, and we're also seeing very high levels of sickness amongst hospital staff. So there's a real stretch, and that's why we need everyone to do everything they can, wear a mask, keep washing your hands, do all of those things to avoid too much indoor social mixing where it's possible, and just everyone do everything we can to reduce the transmission of what seems to be a very, very infectious virus.
And Caroline, why are the vaccination rates so much lower in London?
I think there's a mixture of reasons, and London boroughs have been doing huge amounts, and public health people been doing huge amounts of work to talk to people, to explain why vaccines are important, and to reduce the hesitancy that people have to come forward. And there's a massive campaign at the moment, making sure that there's lots of places where it's easy for people to come forward for a vaccine, walk-in clinics. You don't have to have an appointment. You can just come and get your jab, and that will give you more protection against, particularly against serious illness from this virus.
And Caroline, just briefly, the previous time the major incident was declared, it was declared on the 8th of January and was stood down on the 26th of February. Of course, no crystal ball here, but what would things need to look like in order for this major incident to be stood down?
I think we're going to get more of a picture of that over this next week to 10 days. We're about to see the hospitalisations due to the spread of Omicron virus coming into our hospitals over this next week and going forward. And I think, this is a new virus. We don't know for certain, but certainly even if we get the best case scenario that it's less, it causes less serious illness than Delta, it is still going to cause a lot of people to need to have hospital care. So we really need to take this very seriously and do everything we can to reduce the spread and to protect ourselves and talk to friends and family about the importance of getting vaccinated.
Caroline, thank you. That's Caroline Russell, who chairs the London Assembly's Health Committee.